Understanding colorectal cancer. Prevention, detection, and treatment colorectal cancer. A term that encompasses both colon cancer and rectal cancer is a major public health challenge. In the United States, it ranks as the fourth most common cancer and the second leading cause of cancer-related deaths. While many people associate cancer with unavoidable fate, colorectal cancer is unique because it often begins as small, non-cancerous growths called polyps. Because these polyps can take 10 to 15 years to turn malignant, regular screening offers a powerful opportunity to stop the disease before it even starts. Recognizing the warning signs, early-stage colorectal cancer often presents no symptoms, which is why screening is vital. However, when symptoms do occur, they can sometimes be mistaken for less serious issues like hemorrhoids. Key symptoms to monitor include changes in bowel habits, persistent diarrhea, constipation, or a narrowing of the stool. Rectal bleeding, noticing bright red blood or much darker, tarry stools. Sensation of incomplete evacuation, feeling the need to have a bowel movement that isn't relieved. Abdominal discomfort, persistent cramping or pain. Unexplained weight loss, losing weight without trying. Note, if you experience any of these changes, consult a medical professional immediately. Early detection is the most significant factor in successful treatment. Understanding risk. Genetics versus lifestyle. The development of colorectal cancer is driven by a complex interplay between what we inherit and how we live. Modifiable risk factors, lifestyle. Many risks can be managed through behavioral changes. Diet. High consumption of red meats, beef, lamb, and processed meats, hot dogs, deli meats. Weight and amp, activity, obesity, particularly around the midsection, and a sedentary lifestyle. Substances, smoking and moderate to heavy alcohol consumption. Metabolic health, having type 2 diabetes. Non-modifiable risk factors, biological, some factors are beyond individual control. Age. While it can affect anyone, risk increases significantly after age 50. Genetics. Rare inherited syndromes, such as Lynch syndrome, can drastically increase lifetime risk, up to 80% for colon cancer. Medical history. A personal history of inflammatory bowel diseases, like Crohn's or ulcerative colitis, or a family history of polyps cancer. The importance of screening and diagnosis. Screening serves two purposes. It finds cancer early when it is most treatable, and it finds polyps so they can be removed before they become cancerous. When to get screened for individuals at average risk. Medical guidelines generally recommend regular screening between the ages of 45 and 75. If you have a family history or known genetic risks, your doctor may recommend starting much earlier. Common screening methods. Colonoscopy, the gold standard. A doctor uses a camera to view the entire colon and can remove polyps during the procedure. Stool-based tests, fecal tests. These look for blood or abnormal DNA in a stool sample. A positive result requires a follow-up colonoscopy. Liquid biopsy, a newer method that detects tumor DNA through a blood test. Sigmoidoscopy and AMP, virtual colonoscopy. Less invasive options that examine specific parts of the colon using specialized scopes or CT scans. Staging and treatment pathways. If cancer is detected, doctors use staging from 0 to 4 to determine how far the cancer has spread. This is done using imaging like CT, MRI, or PET scans. The stage dictates the treatment plan. Surgical options. Surgery is often the primary treatment for early-stage colon and rectal cancers. This may involve removing a section of the colon or rectum. In some cases, a colostomy and opening in the abdomen for stool collection may be required, which can be temporary. Advanced therapies for more advanced cases or to prevent recurrence, doctors utilize. Radiation therapy, using high-energy rays to destroy cancer cells, often used for rectal cancer. Chemotherapy, systemic drugs designed to kill rapidly dividing cancer cells. Targeted therapy, drugs that attack specific genetic or protein markers unique to the tumor. Immunotherapy, treatments that help your own immune system recognize and fight the cancer cells. Addressing health inequities, it is important to note that colorectal cancer does not affect all populations equally. In the US, Native American, Alaska Native, and Black communities experience higher rates of new cases and higher death rates. These disparities are often linked to systemic barriers in accessing regular healthcare and screening services. Summary of prevention: while not every case can be prevented, you can significantly lower your risk by maintaining a healthy weight and staying physically active, limiting processed and red meats, avoiding tobacco and excessive alcohol, prioritizing regular screenings as recommended by your doctor. Conclusion: colorectal cancer is highly preventable through proactive screening and lifestyle management. By identifying and removing polyps early, many cases can be stopped before they ever become life-threatening.